integration is also fundamentally important. So one of the jewels in the crown of setting up clinical commissioning groups was the development of clinical leaders. And clinical leaders involved in all of the decisions about commissioning healthcare. What we mustn't do is to lose that when we move towards a much more integrated system. If we revert back to an integrated system, but one based just on, if you like, health service managers working to make decisions about healthcare, we will be the worse for it. We need to carry on having clinical leaders at the heart of what decisions are made about local people for local populations, and that's really important. So clinical leadership at a system level, big population system level, is really important, but also clinical leadership at an individual place, so borough level, is also really important. We need both to work and to actually yield the benefits that integration will bring. But it's not just about clinical leadership for commissioners, it's about clinical leadership of providers as well. So bringing our clinical leaders together to start to come up with the solutions to the issues that we face across our system, so that then managers can then make things happen. But actually you've got clinical leaders driving that transformation that's so important, that will actually keep the patient at the centre, but also serve to improve care and healthcare outcomes for the population that we serve.
So we say it's very much about kind of a clinically informed commissioning, clinically informed provisioning.
Yeah, absolutely.
So that's kind of leading quite neatly onto the next question, which is sort of around the digital transformation of health and care, and the fact that I think most people would agree that as digital health interventions become more important, actually the next kind of challenge for commissioners is what does that mean for their ability to decide what they should be doing, and actually what does good look like?
Yeah, so it can often be tricky for commissioners who are embracing sort of the move towards digital transformation to know what good looks like and to know which innovations they ought to be really seriously looking at and which ones perhaps they might not. So conferences like HET and other conferences, but particularly HET, is really important in actually bringing people together to do that. On a very practical level, it's all very well, you commissioners will hear all sorts of wonderful things that are going on, but actually having the ability to sit down and listen to examples where this digital improvement, whatever it is in practice, and what difference it is actually making to their life as a commissioner or a provider, but also critically to the patient and what the patient experience is. So whether it's things like using population health management tools, for example, really important that CCGs and providers are able to use those sorts of technologies to help them predict better which patients are likely to come through their door most often, so which are the high intensity users they need to ensure they are transforming the pathway of care so that they can deliver better outcomes for them. But also things like in primary care, if you think of general practice, the use of more apps to actually sort of digitise primary care in places and free up scarce clinical time, or any other sorts of digital technologies that actually will help to streamline the pathway of care so that we can continue to be efficient and effective in delivering care for people.
And actually, again, you've been very good so far in helping sort of leading through some of these questions, but the next one comes on to primary care networks. And I think, at least for many people, perhaps myself included, the discussion of PCNs, sometimes it's not always clear exactly what they are, or what their purpose is, and kind of where they fit into the rest of the landscape. So would you be able to kind of just cover those briefly and sort of explain a little bit about what they are and why they're important?
So there's a lot now on NHS England website, so I would encourage people to go and have a look. It's not the best website in the world, but please do go and have a look and find all of the information about PCNs. Primary care networks are really, really, really important because they bring together, for the first time for a long time, general practice with all of the other members of the primary healthcare team. So first point of contact care for the population, you or I, if we need to go and see somebody. Historically, you could go and see the GP, you could go and see a practice nurse, but actually primary care networks brings together groups of general practices to work more formally together as a network, so making the best use of all of the collective skills of all of the practices in the network, not just the individual practice that you're registered with, but also fundamentally to bring in new types of people that you can go and see. So actually using pharmacists in primary care networks to help advise patients about how best to use their medication, what else they might think about before they actually revert to seeing a GP is really important. Community paramedics, equally important, physiotherapists, social prescribers, those sorts of people are really, really important, and they will be based within primary care networks. Primary care networks can vary in size, but the smallest they'll be is about 30,000 population. Normally there would be about between 30 and 50, 55, 60,000 population. There are some that are larger, but the bulk will be within that small neighbourhood. And the idea is that they are close enough to local people to be able to actually get access to care and be able to hopefully treat and deal with a significant number of the issues that are affecting people before onward referral, if that's needed, to more specialist
into
care.
secondary care.
Absolutely,
tertiary
yeah.
care.
So that's really important. And again, for the first time in a long time, we are investing more heavily in out-of-hospital care than hospital care, and that's long overdue. And it's really, really important that we do actually grab hold of the opportunities the primary care networks brings, and all of those primary care leaders working within them to actually really exploit what you can do from a sort of asset-based approach. So looking at the population, how they can help themselves, development of self-care, all those sorts of things are really what primary care networks, if they're working in a mature way, can actually help deliver for the local population.